Welcome to this video on descriptive epidemiology based on Chapter 4 of Introduction to Epidemiology by Ray M. Merrill. In this video, we'll cover the purpose of descriptive studies, study designs like ecologic studies, case reports, and cross-sectional surveys, key epidemiologic measures including rates, proportions, and person time, how descriptive data support public health research and decision-making. Let's begin by defining what descriptive epidemiology is and why it's foundational to public health. What is descriptive epidemiology? Descriptive epidemiology is the branch of epidemiology that focuses on describing the distribution of disease by person, place, and time. This type of epidemiology answers: who is affected? Where is it happening? When did it occur? Descriptive studies are often the first step in understanding a new public health issue. They help generate hypotheses, detect emerging problems, and guide further analytic studies. They also inform public health policy, prevention efforts, and resource allocation. Common study designs. There are three major types of descriptive epidemiologic study designs: ecologic studies, case reports, case series, and third cross-sectional surveys. So first is ecologic studies unit of analysis groups, not individuals or example. Comparing average air pollution levels and asthma rates across cities or limitation. You can't infer individual level associations from group level data. Second is case reports and case series or case report. Detailed profile of a single patient with an unusual condition or case series. Collection of cases with similar characteristics. These are useful for identifying rare diseases or new syndromes. Third is cross-sectional surveys, also called prevalence studies, or measure disease and exposure at the same time or example. Surveying a population for current rates of smoking and hypertension are great for public health planning, but cannot determine cause and effect. Data types in epidemiology. Epidemiologic data fall into four main types. First is nominal data categories without order, for example, blood type, gender. Second is ordinal data categories with order, for example, cancer stage. Third is discrete data countable numbers, for example, number of hospital visits. Fourth is continuous data measurable on a scale, for example, weight, blood pressure. Understanding the type of data you're working with determines the appropriate statistical methods. Key measures, ratios, proportions, and rates. Let's break down three core measures used in descriptive studies. First is ratio, compares two values regardless of whether they are related. Example, male to female ratio of AIDS equals 5. Second is proportion, type of ratio where the numerator is part of the denominator. For example, 83% of AIDS deaths occurred among men. Third is rate, a proportion over time, accounting for how long people are at risk. Example, number of new flu cases per 100,000 people per year. These measures allow us to quantify health problems and track changes over time. Rates in action, incidence, mortality, and prevalence. Here are some important epidemiologic rates you'll encounter. Incidence rate measures new cases over a time period. Example, 28,639 new whooping cough cases in 2013 equals 9 per 100,000. Mortality rate, number of deaths in a population, often expressed per 100,000 people per year. Person time rate accounts for time individuals are at risk. Example, 955 deaths per 100,000 person years in Florida 2016. These standardized rates help us compare populations, even with different sizes or follow-up times. Attack rate and secondary attack rate. When disease spreads rapidly, we use attack rates. Attack rate equals new cases population at risk at the beginning 100 or often used during outbreaks. Secondary attack rate equals spread among close contacts, or example. In a flu outbreak, SAR helps track how many household members became sick after exposure. These are especially useful in field epidemiology and outbreak investigation. Prevalence and special measures. Prevalence equals total existing cases at a given time, or often shown as point prevalence. For example, 1 in 5 adults currently has hypertension. Other important rates. Crude rate, simple total rate, for example, crude death rate. Age-adjusted rate accounts for population age differences used for comparisons between regions or time periods. Age-specific rate, Rate for a specific age group, for example, cancer rate among 15-24-year-olds. These help describe how health outcomes differ by group, location, and time. Application of descriptive epidemiology. Now let's talk about how we actually use descriptive epidemiology in public health practice. Descriptive data may seem simple, but its applications are powerful. We use it to identify high-risk groups, like noticing that a certain age group has high obesity rates or that a specific region has more asthma cases. These patterns help us target interventions more effectively. It also informs screening recommendations. For instance, if data show that breast cancer is more prevalent in women over 50, screening guidelines are tailored to that group. Descriptive findings allow us to evaluate the effectiveness of public health programs over time. Are diabetes rates declining after implementing a healthy eating campaign? That's descriptive epidemiology at work. Finally, descriptive studies help us generate hypotheses that guide further analytic studies, which test causal relationships and explore deeper why certain trends occur. In short, descriptive epidemiology doesn't just describe health problems, it points us toward solutions. To summarize, descriptive epidemiology focuses on person, place, and time study designs include ecologic studies, case report series, and cross-sectional surveys. Epidemiologic data can be nominal, ordinal, discrete, or continuous. Key measures include ratios, proportions, rates, incidence, mortality, and prevalence. Descriptive data helps generate hypotheses, track health trends, and guide public health action. Thanks for watching. Be sure to subscribe and join us for Chapter 5, Descriptive Epidemiology by Person, Place, and Time, where we apply these concepts to real-world patterns.